Hello friends, welcome to Roza Olyai Health YouTube channel. I hope you can subscribe, like the video and share it with your friends. Thank you so much at the outset for sending me requests regarding the topics. And today's topic, as per your messages, is on bleeding disorders, menstrual cycles, how in a monthly period the menses come and go, and sometimes it doesn't come. So to begin with, usually in the age group of 10 to 15 years in young girls, the menstrual cycle starts. So how does it start? Sometimes, I have patients who come to me with their daughters who are as young as 9 years, and they have started with bleeding with their menses. But it's very common. If the menses doesn't come by the age of 15, then it is something to worry. But if it comes during this period, there's nothing to worry. So how does it start? The whole thing, the whole cascade of menstruation starts. The hormone starts from the mind, from the hypothalamus. There's an area here. It starts secreting hormones and it comes and on the ovaries, acts on the ovaries and the uterus. And that's how the menses begins. Now for the first 2 years in young girls, the menstruation cycle becomes very irregular. So don't panic, all those mothers who are hearing me. So what happens is sometimes the girl starts with only spotting. Then she has her heavy bleeding. Sometimes she may not have the bleeding, so there's nothing to panic. Relax. Automatically, after 1.5 years' time or 2 years' time, the menses becomes regular, and she will have a regular cycle. Now, what do I mean by normal cycles? So, if the bleeding is between 2 to 7 days period, and the cycle is so the next menses, what I mean to say, comes after 28 days plus minus 7 days. So the shortest cycle should be 21 days, the longest should be not more than 35-40 days. If it is less than 21 days, it's not good. That means she's bleeding too much. And if it's more than 35-40 days, excuse me, it becomes a little long. So that's also not good. So during this span of period, she will have regular bleeding. So the bleeding, the cloth that is dirty, the sanitary pads, should not be more than 2 hours of heavy bleeding. She should not be passing clots and pieces, So that is when she's bleeding too much. That's sometimes, and you have to come to the doctor and get visit a gynecologist. So this is a durational period, and of course we have a lot of good medicines for these young girls if they are bleeding in excess or if their menses is not regular. We have very good medications which is available and given on time to them. Sometimes there is infection, sometimes because of tuberculosis of the uterus or certain infections, there's heavy bleeding. So there is again antibiotics which can be given. Sometimes because of thyroid dysfunction, so there's hormonal imbalance in the body. So that could also lead to either heavy menses periods or it could lead to periods of amenorrhea where there are no menses. Now coming to the age group that is between, let's say now 20 to 35 years. So during this period, there could be sometimes hormonal imbalance. Now, I've also made a video concerning PCOD, polycystic ovarian disease. I've talked in detail about what happens during this age group. So there's obesity, there's increase of fat in the body, and hence that leads to either heavy menses or no periods. So when a lady crosses the age of between 45 to let's say 50, around that period, this is called pre-menopause. The lady starts having spotting, or sometimes the lady gets a little bit of heavy menses. So that's a time that you should not worry, but visit your gynecologist, because we do an internal examination, we get an ultrasound done, and with that we come to know that what is the problem with the uterus. Sometimes it's just a hormonal imbalance, but sometimes there are tumors. So I just show you one diagram of a uterus, a presentation here. What usually happens that every month this area, this whole thing which is called the endometrium, gets shed off. So you have bleeding from here. Sometimes if there's a tumor, you can see something white here in the uterus, so it's abnormal. So if there are tumors inside the uterus, the size becomes more, and that's how it leads to bleeding and having disorders. So you have to be careful. So that's why I said you should get yourself examined with a gynecologist or get an ultrasound done. Now there are very good medications. Now every time the patient comes, thinks that you have to be undergoing a big operation, a laparoscopic removal of the uterus, or any other procedures, endoscopic procedures. No, that's not right. we have got very good medicines which could be given. Now, if the age is a little younger than, like earlier than 36 years, 37 years, we have got these OC pills. We have these 21, you can see it. There are pills for 21 days that could be taken regularly every night. Pills should not be missed. If you miss it, then there's bleeding. You have to take it immediately. So there are medications which are possible and can control the bleeding. Now, if there's heavy bleeding also during those days, we can give medicines which are safe, especially for those young girls. I know, like with the age group of 13, 14 years, that you're worried whether you should be given medicines or not. There are very good medications that could be given which could decrease the pain. Now, sometimes there is pain during menses. The question would be, maybe because of passing of clot or little, bigger pieces of, clot that is there that is coming out of the mouth of the uterus. It causes pain. There are some medications which are available also if you don't want to be operated. A Mirena is something that nowadays, we put in. So if I show you again, bear with me. So this is put inside the uterus. So what really happens is that this area, this red thing, comes inside, sits inside the uterus, finds its place there, and it stays there. It acts as decreasing the flow of the blood. It helps with that. It helps with contraception, and it can be kept there for 5 years. It stops the bleeding. Sometimes there's spotting in the initial days, but after that there is no menses at all. So these are very good. These are very safe ways nowadays. These are updated medications which is available. So those of you who don't want to go under a hysterectomy, there are options for you. But nevertheless, it's very, very important that you go to the doctor immediately, because if there are heavy periods, heavy menses, you lose a lot of blood. So a normal amount that is lost is 35 ml per month, but if it's more than 80 ml, it becomes a little difficult. That means, like, for example, if I tell you in layman's terminology, too much of soaking of the pads. Every 2 hours you have to change. It becomes like as if a tap is opened. So you have to be a little careful about that. Keep your hygiene well, especially the young girls who are listening. That's the time you have to really bathe yourself, be very, very clean, use soap, wash your private areas very well, and keep clean. And other questions come basically that if we take for the younger children, of course, the mothers ask, can they take these hormonal pills? Yes, they can. If you again go back to my PCOD YouTube, which I've made the channel, you'll come to know there are very good hormonal pills which is given, which is really safe, and that keeps you on the safe side. So I hope this little information will help you to to manage your bleeding and understand your cycles, the period, and get over the problems that you have. And I think you should never ever delay issues related to menstrual cycles, because that will lead into less of blood in your body, less of hemoglobin. You'll become anemic. There's a whole cycle of problems that starts if you're anemic. So when once immunity is down with anemia, less of hemoglobin, immunity is down, and you're prone in getting many infections, and COVID infection, COVID virus is there, other infections are there, dengue is going on, and a lot of other things are there that you have to be careful. And once your immunity is less, you catch these diseases, and your disease becomes more complicated. So the remedy is good diet, protein diet, eggs, all of you, those who can have, a lot of green, fresh vegetables, a lot of fruits, fresh fruits which is available, apple, bananas, kiwi, anything that you like. Plenty of water. Keep your body always hydrated. Take lots of water, and that will help you always in the long run. I know that atmosphere of weather is very bad. There's a lot of climate changes, so you have to keep yourself really, really well hydrated. Remain indoors, especially when there's smog and the weather is bad. Dengue is going on, so you have to really avoid mosquitoes, wear long sleeve dresses, or use things that can be mosquito repellent. And of course, typhoid, not to eat outside anything bad food, because that again will cause problems and add on to your already problems of heavy menses and irregularities that you have. So for all those mothers, my message would be, your young girls, if they miss their periods 1 or 2 months, don't panic. It's sometimes natural for 2 years after they start their menses, but however after that, it needs to be looked after. Sometimes taking medications also will cause little intermenstrual bleeding, like in between your cycles you have bleeding. So go to your gynecologist, take care of yourselves, and Do like the channel, subscribe, and share it with your friends. Stay safe, stay healthy, and all the very best to all of you, and enjoy the winter which is coming.